Okay, you can go.
Hey everybody, welcome back. Dr. James McAdoo. Talking about post-op, how to take care of your vaginoplasty procedures. Number one, vaginoplasty is an umbrella term for multiple things. And what I personally do is 5 or 6 things. The first one is we inject fat into the labia majora. It involves liposuction, usually in the medial thighs if that's the only thing you're doing, or it's an add-on procedure to 360 or whatever surgery you're doing. We use a small cannula and we inject usually at the top area right here, 1 incision, and we come down both sides from 1 little incision right here and come through there. And then the fat transfer instructions would be no pressure on that. It will swell. You can wear normal underwear against it. You can actually put the faja over it to compress it a little bit, but usually if you have too much compressions, it will cause the fat to reabsorb and then the procedure doesn't have a good result. So you kind of have to let it hang out for a good 3 to 4 weeks before you compress it. If you have a faja, you can take the scissors and cut the Velcro or the attachment or the zipper out of the faja so your labia can come through and do the thing. Okay. How do I get to the next page? Go. It's not going. Okay, we'll go this way. Okay, so the next procedure we do is labia minora reduction. The first one we showed you was labia majora fat transfer. So there's 2 different things. There's outside and inside labia. The outside labia we put fat in, but we can also reduce the outside. But that's not a common request. The outside labia can be liposuctioned or injected with fat. The inside labia are usually trimmed because there's excess tissue there. And the trimming involves actually removing tissue with the scalpel, electrocautery, sewing it together with sutures, and that post-op care for that would be to put ointment on the incision line before you pee and before you do number 2 and after. So you ointment, go to the bathroom, use the peri-wash bottle, clean off, put ointment back on. And then after a week or 2, you don't need to use the ointment because you have the first couple layers of cells healing the incision, and the pain and the sensitivity to the area goes down. The next one is perineoplasty, fancy word for tucking the muscles together in the vaginal area near the rectum side of the vagina. It's not the complete vagina closure, it's just the lower portion. And perineoplasty will involve also an incision layer down the middle, the little black line right there. And this also has to have ointment on it before you go pee and poo, and wash with the peri-wash bottle, and then more ointment for the first week. And just for your information, perineoplasty closes the first quarter to a third of the vaginal vault. Oh yeah, we go this way. And there the muscles will be sewed together during the procedure. And we can also do hymenoplasty, which is actually recreating the ring, the hymenal ring, to re-virginize you. And here's the aftercare instructions. So you have to use distilled water because the tap water has some contaminated bacteria in it and it will make you infected. So you take a jug of distilled water, you put it in a postpartum care mommy washer spray bottle. That's what they call it here. This one I think was from CVS. You can get them online, Amazon, Walmart, whatever. So basically you have to use some kind of device to spray you off with distilled water. Use the ointment before and after. You can also do ointment that has lidocaine. That's available on Amazon and local stores. And you can use that instead of Best-Tristan ointment, or a mixture of half and half, to numb the area so you don't have as much sensitivity while you're doing that. And that's the real quick video instruction for vaginoplasty. Now you know the 5 types of vaginoplasty: majora fat transfer, labia minora reduction, perineoplasty, hymenoplasty, and we also do G-spot fat transfer, which basically doesn't have any care because the little holes heal up in 3 days. There's nothing to worry about.